talk, I'll drive.
Okay, so we're gonna go ahead and get started, even though I feel like we're missing, who are we missing? Margie, the two school district folks, but maybe they'll pop in a little bit here.
I can tell you for the school district, just so you guys know, Coulston, I think, went back to school. So they're pretty heavy and pretty deep into their schooling at this point in time.
Okay,
I
well,
got an added one to the agenda, if that's okay.
of course.
We've got some players on board that I think are pretty important, and that is that, and I'm sorry, Greg, that we're going to bore you with this a little bit, but we've got Apple and Dr. Carlbaum and myself. We've got to address the South End and this vaccine stuff. We got to figure out what's going on, because we have getting citizen complaints like no tomorrow, because DOH is telling us, fill out the paperwork, find out if you're qualified. We're going to give you a certificate. And then you have a certificate that says, I get the vaccine. And Jefferson County is saying, no, you don't. The guideline, the Jefferson County folks are not even close to matching what DOH is doing. And Apple, maybe you've got some insight into that. But currently, unless you're 80 years old, it doesn't follow the 70 and 50 in the same household rule. And so we've got folks here, and of course the South End wants to know, when's it coming to the South End? And I can't give them an answer to that. So I'm glad we have the players. Sorry to not take over your meeting, but it's a South End reduction meeting. So I felt it was timely that we probably need to address that. And hopefully our MPD can have some insights.
I have a few things I can say, but David, go ahead if you have other information.
No, I've been emailing with both Jefferson Healthcare and Dr. Locke about how they might envision EMS playing a role in vaccine, and I've not really heard back. I'm getting the sense that they're all very busy. I've emailed a couple reminders. I do know there's some kind of rogue pop-up vaccine clinics in Chemicum, that the vaccine's coming from I don't know where, that with less than 24 hours notice asked East Jefferson Fire and Rescue to provide personnel to monitor patients, which they're unable to do because of staffing shortages. So
I think that's coming from Tri-Area Pharmacy. They've got an allotment. They got in the game 2 weeks ago, I believe, and they got a shipment of about 300 or 350. And they've been doing folks in 1A through their pharmacy, but I think their plan next, and they have had some support through KITSAP's Medical Reserve Corps, the MRC, which we do not have here in this county, to deploy that. But I think the Tri-Area Clinic or Tri-Area Pharmacy is hoping to broaden that out, since pod events are now becoming something that seem more viable. It's been super complicated. The hospital has also indicated on their website that they are in fact going to be part of those type of pod events in the future. Right now, they are just really mired with trying to work through finishing 1A. I think they've done a really great job. They've kept up with the healthcare workers and then some who've been in 1A tier 2. Those will be ongoing. They're starting 1B. They decided to do age bands within 1B. So they were going to start with 80 and above. Actually, it was 85 and now it's 80 and above. These things are changing by the day. And on their website, they've been as clear as they can be, although I know it's not all clear to citizenry, about either making an appointment if you fit in that definition through the website, or calling a phone number if you don't have access to the internet or to their website. Bringing it to South County is omnipresent on our minds. We have multiple ways that that could happen, and we're working on the back end to try to coordinate to figure that out. So simultaneously, just for those who don't know, the Department of Emergency Management has been queuing in this influx of eligible volunteers who have medical backgrounds, who have licensure that's still instated, who can do vaccine application, put shots in the arms. That process doesn't happen overnight, so they're vetting those people and getting their paperwork done and getting those folks signed up. There's a credentialing process that has to happen before they can be deployed anywhere. Many of those people called into public health saying, can we, volunteer for you? Willie Benson and I, and maybe other people, agreed that it would be best for Department of Emergency Management to pool the volunteers as the influx was coming in, get their paperwork started, because that is a process of its own, manage them. I mean, it's a lot of people, which will be helpful because we need to deploy them in multiple scenarios. What I hope, and what Dr. Locke and I are pitching for, is that the hospital, while it only has Pfizer vaccine and at a limited amount right now, which is another reason that the age bands needed to be exercised within phase 1B. What I'm hoping is that they will then be eligible for the Moderna vaccine that can be deployed to their South County clinic, et cetera. Simultaneously, they've offered to start planning around these pop-up mass vaccination events, which I think they would most likely focus in South County. Maybe there'll be one at Quilcene School. We know that the school districts have already offered to Dr. Locke that they would be willing for their gymnasiums to be places for these eventual events. We hope that their clinic in South County can be a major generator of giving the vaccine to folks in South County. Of course, it's one location, right? In Quilcene, it's not in Britain. The part about EMTs or just emergency response workers helping out with vaccine deployment, that is something that I'm eager to get on a meeting that I'm not normally a part of to see where the status is with that. Maybe you all know more in terms of who's reached out to you, but it seems to me that we need to eventually deploy or could deploy help from fire and rescue, et cetera, to do some of those vaccine events in South County beyond, let's say, the Jefferson Healthcare Clinic in Quilcene, or a school event at the Quilcene School or at the Brennan School for that matter. That's about the extent that I know at this moment, but there is so much going on, and there are multiple meetings that are happening now and in through the day and into tomorrow as well.
Thank you, Apple.
I think the Jefferson Healthcare's website is really good about this right now, and I think using it as a clearinghouse for an entry point into this as a group, if we all push them there first, it will allow a more consistent response.
Yeah, I think citizenry have often tired of hearing the sentiment, go check this website out. But honestly, with how fast things are changing across agencies and the level of complexity of all of our communicating together to help each other out, I think these websites are being updated by the hour. I know ours is. We really do have to educate folks or encourage them to really use it as a tool, not just a place for parked information, but it is a tool that's changing sometimes by the hour. And that's unsettling to people. I understand. This deployment should have been a big plan that would have been executable with a lot of clarity, but it's just not the case. There's a lot of moving parts right now.
I'd just add a couple of things from the Jefferson Healthcare point of view. So one is that age bands are based on the availability of the vaccine. So as we get more vaccine, then that age will creep down. But right now we want to make sure that we get it to the most vulnerable parts of our population first. And that's why they've decided to do it, but based on age band. And they want to make sure they have the availability of the vaccine before they do that. And the second is just to echo what Apple said. What I'm hearing from our chief medical officer is that the information from the state changes almost hourly. So it's really hard to develop a plan when the information is changing so frequently. And I think I've been peripherally involved in with what's going on at the hospital, but I can tell you that they are working incredibly hard and have put a lot of time and energy into this process, and that, I think they're doing an amazing job with this, what is really a difficult logistical problem nut to crack. So I would echo, have people keep checking the website, and I'm sure as we get more vaccine, that age limit will come down, and pretty soon there'll be more availability.
Yeah, I'll just add to that I did hear this morning that, Jefferson Healthcare's vaccine line right now is really one lane, maybe two at times. It can be 4, it's 2, okay. It can be 4, and so mounting that extra 2 lanes, which wouldn't necessarily be an immense help to South County folks, except for those who could come up here. That is largely maybe going to be staffed by some of these volunteers that are really in their vetting process, and it's going quickly. I'm already getting responses from several of the volunteers I sent there that their process is coming to a close and they're getting deployed, they're getting stationed, and they're getting appointments for where they're going to be deployed to on which days. So hopefully the hospitals indicated to me that they would be interested in definitely having access to those volunteers to help further staff those 2 extra lanes, which will help increase volume at Jefferson Healthcare.
Could I make a recommendation, Apple? It sounds like what I'm hearing from Chief McKern is there's a disconnect between what people are reading on, Como news or seeing on the TV news and the local situation. I wonder if some sort of press release to the local papers, even if it's to say things are dynamic, things are changing, the local rules are different because of restricted resources, check these websites as often as you can, or call this phone number every other day, or whatever you want people to do, might be helpful to help assuage some of the confusion. And I think the public is okay if you're honest and says things are changing, so fast, but here's the place we're going to try to commit to putting the most up-to-date information.
So that's a good idea, and I think that's totally prudent. I will say that as of last, I believe it was Thursday evening at around 4:30, Jefferson Healthcare did have a press release about sort of their further teasing apart and making streamline the process for people to approach them if they're in phase 1B. But I mean, the more press this can get to assure people that we're listening and that we are working tirelessly to make this effort happen is a good thing. So thank you for the recommendation.
I think we're sending out a press release 2 or 3 times a week right now, but that doesn't mean that the leader will necessarily publish that. So that's always, kind of a challenge. I mean, it feels like it's a public health emergency and that they would do that, but I think we've had varying success with them publishing the information that we pass along to them.
I can just make one little comment on that. The challenge we're having, Apple, is that that's great that all you guys are doing this, but your public health is sending out one, Jefferson General is sending out one, and then occasionally now we're every 4 days coming out of Department of Emergency Management. So we're 4 days behind a little because they're not doing every day like they were in the beginning back in April, March. We were what we call unified command. And what we mean by unified command is that everybody sends their messages to one public information officer who pushes out what's going out. And that public information officer would check with health, would check with Jeff General and the CEOs and the public educators. And they'd also, bottom line is they check with the hospital as well to say, okay, what do we have? And Dr. Locke. Dr. Locke has the final say so what goes out. That's not happening. Our social media is broken. What you're finding is that public health is doing social media, Jeff General is doing social media, Department of Emergency Management is doing social media, and occasionally a fire department throws in another link into there. What you've got is complete chaos and complete confusion amongst all the citizens. And where do they go? They knock on our doors, the fire department, and say, give me answers. You got answers here. We don't have answers. And we're like, today I got a phone call and I sent her to Jefferson Healthcare. I finally got her on the phone. That didn't work. She couldn't get any answers. Then she went with health concerns, needs the vaccine. Then I sent her to DOH, who came back and said she's qualified. Where do I go? Well, you go to Jeff General. Hopefully you're catching what I'm saying is that it's really confusing for our folks. We got to have one voice, folks, not 5.
Don't send them to the state DOH. Send them to Jefferson Healthcare. That's our voice.
I agree. I was going to make that clarification. DOH, while important, is not the place for the answers for access in our own county.
Okay. So you're saying Jefferson County does not follow DOH rules?
I'm saying we have our own interpretation to respond to our particular population. Many other counties who are in 1B and many aren't, like King County is fairly stuck in the middle of 1A. They're not going to 1B anytime soon, even if the governor did say that, because they're massively behind.
A third of our population's in 1B. I mean, it's, you know, the dynamics are different from county to county, so it's difficult to use a statewide approach. I mean, we just got to look at our local clearinghouse of information. That's Jefferson Healthcare for the vaccine.
And like John said, the age band concept really is really viable and appropriate in this county, even if it makes certain age brackets feel like they have to wait longer than they had hoped to. It's a matter of triaging from oldest down to the bottom edge of that particular phase and what the age criterion is that, you know, helps us prioritize the people who would die the most, so based on age and severity of illness. Their response, we're triaging backwards from oldest down to 65, I believe, or 70, sorry. It's changing every day.
Today.
70.
Thank you. Dr. Caldwell?
Just one final question. I guess I'm struck by the dissonance between the Phase Finder app that a lot of people are using or the website. You know, it's like, go to this one place and we will put in your info and we'll tell you when it's your turn and here. And so I don't know if you can make recommendations to the state to have like a based on geography link you somewhere else or what? Because I think a lot of people are using that app.
We are making those suggestions to DOH. The health officer does that on his calls with them, is numerous ones. And
Sure.
We're not in this alone. That dissonance is felt in many counties. It's not that a Phase Finder app isn't important, because what it looks like on the face of is one distilled place that folks can get the right information for their specific county, for their specific age or their specific risk factors. And it just isn't that robust because there's so many changing parts in each county. I don't know how that app can actually keep up with the changes in our county. It doesn't mean that it can't overall, but right now it's clunking along, in my experience, in terms of the discussions that I'm having. That's why I think Commissioner Brotherton has a good point. As much as it might feel confusing to citizenry, going to the Jefferson Healthcare site or checking out the Safeway pharmacy, which is now on board, or the Tri-Area pharmacy is a good first three-pronged step to take. And we really just have to work with what we have and further clarify it. I realize that the communication across the various factions that were identified a little bit ago is difficult. It's difficult for us too as a player. I don't know that there is the ability to have one unified voice across all of those entities. That is wishful, and I would agree that I'd like it too. But managing that is difficult. I do think there still is a sit rep production every week through the EOC with input from the various factions that you mentioned. And that might be the place to go back to. It certainly was robust in the beginning of the pandemic. I have so many things on my radar here as far as the health department is concerned that I'm not actually reading those every week, like some of you probably are.
Thank you. Do we all feel good about that topic?
Sorry about that. Didn't mean to bring
No.
up a topic.
No.
I think this is community health improvement. So I think anything that is relevant to that is absolutely what we should cover on this call. And Apple, I'm sorry I didn't know, so I could have had you more prepared when you came to
Sorry
this
about
meeting.
that. It's just because
I'm only as prepared as the last meeting I was on, I can assure you.
Okay, well, we'll turn our attention quickly to the agenda. We may compress some things, we may push them over to the next meeting, but I think what needed to take priority has so far. On the recap, everybody knows everybody. Can we skip introductions? Okay. On the first slide, you'll see, or the second, third slide, John, I think moving on to the next one, you'll see an overview of where you can go to find materials that are related to this meeting. The first link takes you to the Be Healthy website, which is the Jefferson County CHIP website. The second link takes you to a meeting that has all of the materials related to BHC meetings. And then the specific links in that third bullet take you to last month's meeting video, as well as the slides and the summary notes. So they're always there. In fact, if you go to just the BHC related meeting materials on the second link there, you'll see there's even a link to today's slides, which has one extra slide than you guys have because I just got it in. On the next slide, John, do you want to talk a little bit about the resource directory?
Yeah, I can be really quick on this. So we have just recently completed a handoutable resource directory for our community. I'm going to actually be traveling to South County on Friday to distribute them at the Quilcene Community Center and the Brennan Community Center, and to some people I know at the schools. We're just really excited to have something that's pretty simple that you can hand out. Chief McCurran, I'm wondering if you guys could use a few at the fire hall, and if you want me to stop by and drop some by on, good. Okay, I'll do that. And I just think it's a useful resource for our community. It's not all inclusive, but it's intended to be a quick reference for people who are looking for resources in our community.
I'm trusting everybody also got the link to the more full version of the online services. Okay, great. On to the next slide, naloxone possibilities. Poor Apple's probably trying to eat lunch and now I'm going to ask her to talk again. Apple and I had talked briefly about the possibility of public health having a naloxone supply, and I was hoping she could tell us a little bit about the possibilities there.
Well, I'm afraid that I'm not well prepared to answer this right now.
That's okay.
My deployment has been unifocused. We've had some staffing shortages here and causing, anyway, there's a lot going on. I do know, I'm just going to corroborate what you said last time about the UW being one of the providers. And with that comes quite a hefty, but very learnable system in terms of data entry.
Mm-hmm.
I'm remiss that I don't have contacts for you, but I can do that. Lori, I would love it if you and I could touch base about this specifically, just so I can nail down some concrete tasks that I can get done or help.
Or that I can go do for you. Yes.
Yeah, I do need that intervention at this time.
Okay, I'm happy to do that. I've also been digging around to see if Department of Health, there's through the SSP, the regional SSP, or maybe it's the statewide SSP, I might be able to find some potential programs there. So just know that we are digging into the possibilities. That was one of the things on our list, and it seemed like a very logical place to start the discussion around the naloxone, which is where are we going to get it? Perfect. All right. Go ahead, Dr. Carlbaum.
I think one of the other things to think about is once you have access to a reasonable supply is, I think it's very doable that we could train the EMTs and paramedics to distribute naloxone. So if they see someone, revive them with field naloxone and the patient refuses transportation, which is quite common, to then have an intervention where they can pass out a resource card and give them naloxone and even do some teaching. I think we'll have to do some education on that, but I think it's within the abilities of the pre-hospital team.
Excellent. John, I saw you move there. It's funny, you're a little bit in the dark, so I can't really see your expression if you're looking to talk or not. So if you are, just unmute yourself and talk. Okay. That takes care of the first element of the group discussion. On the education effort, I know we don't have our folks, we don't have everybody on this call, but as people went away and thought about the naloxone education part of it, I'm just wondering if there are any thoughts about what that could look like or what you don't want it to look like. And I'm looking specifically at Chief McCurran and Trish on that one.
Well, the education piece, I think what she's going to tell you is what we did in Mason County was it was the social media outreach. Social media happened to be the link for it all, and I think it's just getting out there and getting, again, the right message to the right people at the right time. If we can get those rights to it, then I think we're in pretty good shape.
So if we do,
that's our first step.
Okay, so if we do social media, we train up the EMS side of things, as Dr. Carlbaum was talking about. And then I know that Christina talked about doing it at some sort of gathering spots where you likely would run into folks who are the family of those folks who might use it so that they are prepared in the event that they need to use naloxone on a loved one. Apple?
Many of
then-
you have done this more than me, but I just know in the educational arm of this is the stigma reduction, which you're all sort of alluding to help everybody know, not just folks who are suffering from SUD, but their family members and any citizen for that matter. I'm wondering, with the success in other counties and cities, you know, librarians have been trained and teachers have been trained. What about shop owners? I'm thinking about Quilcene and Brennan and who is there who might want to have them on, you know, behind their counter, just to make it more ubiquitous, because I think that is what sort of brings the reactivity down about doing it at all. And then seeing critical people ask for naloxone kits for their family, such that you're not outing yourself as a drug user or your family, but you are simply saying, could I have one in my first aid kit in my house in case someone needs it? That was very influential for me when I was new in this field. And one of you on this call actually made that request in a meeting I was at, and it was a big deal to me. It really helped level the playing field that anybody can have one. It is a tool, and it's part of people's ability to perform first aid in their community. I mean, I'm saying this very globally, but that's where you can pull back the reactivity in small communities, in my personal opinion.
Thank you. Dr. Kalbaum?
I was just going to mention, you know, thinking about this as a public health intervention, much like AEDs. And so we train high schoolers in CPR and AEDs, and I hope in tourniquet application. And maybe we should just weave this into that so that, you know, the kids are going to save us all anyways. And so they're the future. So for them, it's no big deal. They also get hands-on time to practice, so it's not scary to use. And then that can stimulate conversation at home. You know, what'd you do in school today? Oh, we learned how to use this antidote in case someone's unconscious from an opioid. And then, you know, you could even think about, do you give kids a naloxone kit or just give them a coupon so they can get one easily? So it's no big deal. I do like Apple's idea also of putting it like an AED in a public location. I mean, I think opioid overdose is much more common than cardiac arrest, frankly. And having it available and making it like it's part of first aid is smart.
In the school world, we do a pretty good job of blasting information to our community. We have several social media channels, and then we have other ways that we can get information out. So I think we could, I know that in Brennan we could do that easily, and I think Quilcene as well. We're good at it. I liked what, I can't remember if it was Apple that said, we had a tragic event happen in Brennan yesterday. Just a horrible tragedy that I suspect is probably drug related, and I think having it behind the counter at the Brennan store would probably be an absolutely wonderful thing. And I would be comfortable calling the store owners and talking to them myself if, I have a little bit of a relationship, or I'd be happy to set that up for someone else could. Anyway, but I think it's important work.
I just to add on to what Trish said, I agree 100%. And I think having it in stores is critical. I mean, at my store in Discovery Bay, when it was still open, I watched a sheriff's deputy save someone's life with a naloxone, and soon after I got a kit to have behind the counter. I mean, no one wants to have a tragedy happen on their doorstep that is preventable, easily preventable. And I think it's easy. I would be happy to assist Trish and, going around to the businesses and the other groups down there and saying, hey, this is a way to prevent tragedy that's very cheap and you can have it.
I'd appreciate the help. My expertise in this area is very small and unimpressive. So I would appreciate the support, but I'm happy to chip in. It's important work.
I think the largest portion of doing this work, as you call it, Trish, is really the personal connection, especially for your communities that are smaller. It's more that than it is learning how to use the tool. And it's actually being smart enough and having the plan enough that you have one on hand where it's needed, which is why I sort of was mentioning that, have them everywhere. Where do you get your hair cut?
Yeah.
Post office. I mean, really.
with the no shame approach, you know.
The
So
no shame approach, exactly. And I would just add, this is probably obvious to you all, but there are videos, YouTube videos, I mean, they need to be vetted, but about how to administer naloxone that are so straightforward. I think they're in under 6 minutes. It's actually what we use to train our staff here in public health, who are, you know, health professionals, but may not have had any interaction with naloxone. So we used a sort of ubiquitous video that anybody could watch, part of the public domain. Those are things that can be recruited and deployed via social media or on, you know, your school website or what have you. Anyway, best to not think about it very complexly, just to kind of think of what the easy pathways are such that people feel the no shame part of it, and then they'll use it. That's the key.
Chief McCurran, anything from you before we move on to where it would be distributed from?
No, I think you're all on spot. You were looking for a source to get some of that. You might reach out. I know that the law folks, somehow they got a secret grant through, I think, the state system. And so you might reach out to the sheriff and potentially Port Townsend PD and see. They have the resources for a fairly large amount of naloxone. I know down in Mason County, that's where they got theirs through the joint accreditation company, and they put out a grant for a couple hundred of them. So they got in like 500-600 of those things at a time. So, hey Doc, the concern is that self-project is going to be a little bit more than the dosage. We're back to that dosage issue again of giving too much, and you're okay with that?
Yeah, it's probably more than is necessary with the crappy heroin of Washington State. But I think if that's the way it's manufactured and packaged, it's fine. And there's a small increased risk of seizure, but that's a time limited thing. So,
okay. What
that's
Doc's
I think it's interesting you mentioned the sheriff. This could be an opportunity for the police to build some positive attitudes around who they are and what they do. And if they are involved in some of that education, especially in the schools, that could really probably be good optics for them and help young people maybe not be so fearful of them or whatever other impressions they're getting from the media.
That's a good thought. Apple?
One of my dreams, and this is long ago, I've not thought about it for a while, but some kind of campaign about everybody having one in their glove box. Not everybody has cars, clearly, but just
making it
what is a way to bring it in your life where you have access to it, right? Where put your seatbelt on, right? Cover your car. Where's your naloxone kit?
And for him, it's going to be in his helmet. Okay, so back to the where we would distribute the naloxone from. We're thinking law enforcement might be a place that we could get it, but where do we want to keep it? Can we keep it at the fire station? John, I don't know how this is handled.
Well, I mean, I think there were some good suggestions here earlier about, a pretty widespread distribution to, community centers and stores and, places throughout the community. So then I think it becomes an issue of if we get places like that to agree, then where do they go when they run out?
Exactly.
And I think, my thoughts are schools, fire halls, and the medical clinic are kind of the home bases for health in the community. So those are kind of my thoughts when we talk about that.
Is there a general openness to those three areas in South County? Okay, all right, great. And then on to the cadence of how, maybe we should say not even how often, but when do we want to start offering education? Like if we give ourselves a timeline and then we can figure out that, is it that we've got sheriff team going into the schools, or where is it that we're starting that? Are we starting to push it on social media? What is a target date for this? Is there anything that needs to be done before we let this loose on the community?
Hey, Apple, what's your thought about how difficult it might be for us to get a reliable source to obtain naloxone? I think you have more experience probably than anybody else I mean,
Maybe.
is that something we can do in a month or in 2 months or 3 months? What's your kind of take on that?
You know, this program was well honed when I got here, so I really don't have a lot of firsthand experience of propping it up. I do wish Margie was on the call. She has immunization clinic today and COVID cases to track, so she's not here. John, I think I'd rather pass. I mean, I think what I can say is, given the emphasis on the value of this and the availability of them, I presume, it would not take more than a month. But I certainly can't say from experience. What if you planned for a 3-month period just to be safe, and we can work backwards? We have to figure out who those vendors are and then what kind of system, you know, they require. So we have a system where the inventory is documented and redocumented in a million places, and we have a database, and you have to learn the database such that we've input information into it, because we have, complicated funding streams that this is a part of. It would be different in this case, I believe, and I guess it has something to do with which source you choose from, how labor intensive that might be. And I just don't have enough experience outside of our one experience really to say. Could I put a bookmark on that and maybe have go talk with Margie later and have a report back to you, Lori, about what she's
Sure. And I think I was just trying to get a sense of that, because my thought was it would be nice if we could get some education going before the end of the school year. So my dream is that we get it started so that we have time to at least do a couple of trainings with school kids before they're off this summer.
I agree, and I think education.
I'm gonna throw a day. I mean, what if we shot for the end of March? That's 2.5 months. And if Apple comes back and says it takes 6 months to get a distribution, we can adjust then. But I think it's always good to throw a date out there and start shooting for it. And yeah. I feel like, if the gods smile on us by the end of March, we should be able to have naloxone in South County and be able to start distributing it.
And another point with regard to stigma reduction is that those seeds can be planted even prior to having the tool in hand to distribute. I'm not trying to give you more work to do, but
no, and we can be very deliberate and intentional about that. We'll listen to this conversation and start to set up some actions, and by the next meeting, hopefully start to deploy some of that as well. So you're absolutely right, Apple. We are not just sitting waiting by any stretch. Okay. So moving on then, Dr.
I hate to throw a cautionary tale, but I guess I hate to say it, but COVID is still very real. Our peak numbers in the hospital are the second half of February. I don't think by March we'll be out of COVID. I think hearing the vaccine rate of what it is right now, unless there's some miraculous change, I think we'll still be vaccinating a lot of the community then. Would it make more sense to push it back just a little bit and have it a summer safety slam, make it a June push for schools? I don't know when schools get out in South Jefferson.
Just remind me when they get out. I'm sure she knows.
June 7th.
I'm trying to unmute. I think we're out the June 11th and Quilting's out the 18th.
Oh, wow.
Okay.
What I hear you say, I mean, to me, I'd like to have it out next week, but it seems like, I don't mean to say this negatively, but with the vaccination drama and who's next and when next and all of that, I do have some concerns about just plopping it on top of that. Also, but I'll be happy to jump on whatever. But also, all of these things are so much harder because of COVID. I mean, maybe we could, I don't know, but it's going to be like this till at least next school year, I think. So. Well, I'm open to whatever, but I do hear the concern about.
Let's shoot for June. I mean, I agree with Lori. It'd be nice if we could do it before the end of school, so we could have some education while kids are still in school. So how about if we push to June 1st and try to do some of the education in May, so that when the naloxone's available, hopefully in June, that we can, people will already be educated and ready to do it.
And we can start
I didn't hear that part either. Is people, you know, we tend to have short memories. If I talk about what's going to happen in June or what's going to be available in June and February and March, that'll be like you know, 100 years away for some of our crew too. But I think June happens quick and it's busy. But if we started in May, kind of prepping things, that might be great.
Okay. So maybe by the end of April, we'll have a social media push going. May will be education. June will be really jumping into it.
We'll be back in
Okay.
after spring break, and yes.
Okay. Now we can always come back to this and take another look if it looks like it's just too much to put on. But I appreciate that everybody is animated about getting it out into the sphere there. John, I'm going to pop us quickly over to the discussion about JHC's engagement.
Sorry, you guys, trying to get off mute like everybody else. So some things have happened at Jefferson Healthcare. I know we talked about involving the ER in this meeting, and Cindy Krechtoval, who is the current was the current ER director, is leaving at the end of the month. There's a nurse that's taken over that role as an interim leader. And I guess I had a question to this group, whether you want me to invite Catalana to the next meeting, or whether you'd rather wait until that position is more completely filled.
Historically, how long does it take Jefferson Healthcare to fill positions like this?
1 to 3 months, I would say.
I think this is important. I'd recommend inviting the interim manager if it's going to take up to 3 months for the new person, but I'm open to whatever the group thinks.
Might be slower right now too.
Yeah, it might be. Oh, okay, that's great. I agree with that and think that's a good direction to go.
John, did I misspell her name? Catalana?
No, I think you got it right. I just mispronounced it.
Okay. Let's get it right on something I've got up on a public website. Okay. Go ahead with wound care.
Yeah, so I've been in correspondence with our wound care clinic after our discussion at the last meeting. And my first question was around what's the prevalence of the number of injection site wound care that they give. And the response that I received, I'm friends with one of the nurses up there, and her response was that it's actually a pretty common occurrence and that it is kind of significant. So I think with that information, it would be good to involve someone from the wound clinic. I invited my friend who suggested inviting Mary Allen, who's the nurse practitioner of the wound clinic. And if you guys agree with that, I'll also invite her to the next meeting. Kind of a thumbs up on that. Yep, okay.
Great. Okay, and then tracking right along to, I just wanted to let you folks know, we've talked a bit here about stigma and generally about the need for communications around that. And I wanted you to be aware on a broader, longer term, there's some money at the regional level that's looking at addressing communication around stigma for the region. And I'd really like to be sure that whatever dreamy ideas we can come up with here at the South County level get carried back to that. So I wanted to log the thought. There's some money there. They're thinking about it. I'm sure they'll be eager for some feedback, and I will be happy to sort of make sure whatever we can come up with here gets taken there. I don't know that they would give us money for a singular campaign, but it's possible that we could come up with some smaller amount of money that does something very specific to South County that's buttressed by something that's going on at the regional level. So just wanted to log that thought. And I know it's something in our last priorities and next steps that we talked about last time that we wanted to start thinking about addressing. I'm just bombing right through here. So if there's something, any other questions on that topic? Okay, so now I'm popping us on to the harm reduction budget considerations. And John, I just put this here to sort of give the overview. If you go to the next slide, there's a nice big version of that. Yeah, there we go. here I just wanted to show an overview of what I think might be areas that we should think about. This is a very rough sketch. I don't know what personnel we're going to need. A lot of it, I think, could probably be dealt with for a peer network. Now, this is when we're starting to talk about the syringe exchange part of it all, but I think it's never too early to talk about funding for that. You've got a little bit here. If this was a mobile program, we'd need to think about how we were handling the mileage and the vehicle, et cetera. And then these are some specific supplies that I could think of or that I was able to come up with. You see, I've got some figures in here, but if there are other major categories that some of you who are more familiar than I want us to add into this as we start thinking about it, I'd welcome your input. And now I've got to find where people went because I can't see you. Okay.
Hey, Lori,
Yes.
this is Apple. I'm sorry, I may not have seen your email with the notes. Will there be, is this in a note, these slides? Like in an email?
Yes, they are. And in fact, you could go right to the Be Healthy website and over to the library and down to the BHC page. And there's a link to this exact presentation there.
Excellent, thank you.
To you right now, if that would be useful.
I would love that.
It's attached to this meeting invite.
Great,
Okay.
that's fine.
Okay, great. So back to the budget, is there anybody want to say anything about this just rough sketch that we've got up here? Looking across, seeing nothing. Okay, I'm gonna move then.
Maybe one comment would be, are there other counties that already do this that could serve as a reference point? So I don't know if King or Kitsap or Snohomish or Pierce or even Mason do this already, and would they be able to give you a sense of their budget?
So I went to Mason County to get what I've got here. And I think probably the biggest usefulness was some of the specific pricing they had around syringes and small containers and that sort of thing. And I also heard some interesting, a couple of interesting bits of feedback. One was how they were dealing with their sharps. They take them out to the waste management. They have a deal with them where they get taken sort of carefully and separately and are stored in a separate place and then taken to wherever they call the big pile that they go to. But I don't know if we'll need that here because I don't know what our situation is going to be with the sharps disposal. But the thing about Mason County is theirs is a much bigger program than what we're looking at here. So they're, they have a vehicle. Maybe we could use vehicles from public health. We couldn't, but we haven't really explored what we're really going to need.
Yeah, I think there is a lot of exploring to do, and I just want to make sure that I say, sort of on behalf of my own crew who do this already in the county, we do it in a small level, and we do it only out of this building here in Port Townsend. So clearly that's not equitable. We do have people come from Clallam sometimes, and even Kitsap at times. So I want to make sure that the expertise that we've developed over the many years of doing this with great support from our commissioners and our Board of Health, et cetera, is available to you all to make this make sense. And, I don't know what part public health will directly play in it, but I think there's opportunities for that expertise to kind of feed its way. I mean, maybe
Absolutely.
There's a fleet involved. Maybe there's the mechanics of, propping up a central place where the needle exchange would happen in South County.
In fact, it's a slide that's coming up that we're looking at some options.
Right.
Okay. Any other thoughts on that slide before we move forward? Okay. Just of note, I wanted to, this is a group that might be interested in this. Just this week, I heard on NPR, they referred to a study that had been published around some medical treatment for meth addiction, which is something that's already out there. And I wanted to highlight both that there's something out there that's being said. It's in the New England Journal of Medicine. However, it isn't like it's a slam dunk. There's a small percentage that it seems to affect positively, but a small percentage is better than no percentage. And there are things that are already available for use. So I'm just highlighting it here. There's links that you can go to read more about that. And then moving on to the next slide. Just looking at how we're doing on time. Okay. So far, we have not talked about these things that you see highlighted in blue on the list. The specifics around transportation, the specifics around protecting children, which is something that Tricia brought up at the last meeting, sort of as a real priority for this community. And then I hope that Chief McKern feels like we are being very directed and intentional about making a plan and making follow through happen so that we really get some action and boots on the ground quickly. So what I'm asking this group right now is, as you look at these two topics of transportation and protecting the children, is there any step that I or we or you could take between now and the next meeting so that we had a solid platform for some relevant discussion? Or you can tell me we need to wait and talk about the other things that we've got going first before we jump to this. I'd like to hear back from the group.
I think when it comes to transportation, our stakeholder we're missing here is Jefferson Transit. They probably would be a key link. I know that they were a key player in Mason County, Mason Transit Authority, what turned out to be a very, very big player in that process as well. And one of the other keys that we found with transportation in Mason County was we finally had to put, we had to reach out with a grant to hire, there's a company out of Kitsap County that actually putting together the bus that went around and picked these folks up and brought them back to a center. But I think one of the key players that we have at our right now, a tool that we have in our toolbox is Jefferson Transit. So we probably need to include them as one of the stakeholders to the meeting.
Does anybody have a somebody that, yes, John?
I'm actually on the Jefferson Transit Citizens Advisory Board, so I have pretty good contacts there. So
Great.
I think when it's time to start having that discussion, I certainly can be the go-between between this group and Jefferson Transit, or invite somebody from Jefferson Transit when we're ready to start having that conversation.
I'm also on the JTA board, as all commissioners are, so happy to
Great.
maybe amplify John's request or however we want to approach that, but I'm happy to help there too.
Okay, and then there's the question of when do we want to start trying to address this? Do we want to focus on naloxone right now? Do we want to try to do something concurrently? Thoughts?
I have another thought, but it doesn't relate to your question, so I'm going to hold it.
Well, I want to hear Tricia's, so don't anybody let go of that one. Anybody on this one? Because John can go ahead and do this and maybe report back on, he's got a name, or between John and Greg, if there's a name that comes up that we could start. I don't want to have them come to a meeting that we're talking mostly about things that aren't relevant to them, because I know their time is important too.
I think it would be important for us to do a little more definition about what our ask of them might be. So before we engage them, so that would be my preference, that we have a better understanding about what their role might be and how we might use them before we, before we get there. So I'd like to bake the pie a little bit more before we serve it to them.
Okay. So perhaps at our next meeting, we'll set aside 10 minutes where we talk a little bit about that. What do we really want to accomplish? And I recognize 10 minutes isn't enough. That's a little thumbtack into that conversation. Greg, any other thoughts?
I think that's good. I'll just say that one resource that's not very utilized in Jefferson Transit, especially now, is the van pool facilities. And while they're kind of guided by RCW and some state mandates, it might be an avenue of investigation to see if we might be able to qualify to bring those two things together. I don't think we have any active van pools in Jefferson County now. So they're
Okay.
the vans are just sitting there.
Great. Now I want to come back to Trish. Trish had something.
I guess I don't know really what the parameters of this are, but when you talk about harm reduction and you ask me in a school, I think I look back to what my contribution was. I wonder about Child Protective Services. Where are they? And when we talk about harm protection, and where, how do we collaborate with them? I have trouble collaborating with them. And so how do I or we get better at that to protect our kids?
I wholeheartedly support that question. We struggle too, and we work with them in concert with shared children across our programs. They are, I'll just tell you, having been in touch with them recently, they are all working remotely, which seems to have been really complicating things for their staff and the way that they do business. And I don't really know the extent beyond that, but I think, Trish, that's an excellent point. If you're speaking about harm reduction with regard to drug use and protection of the community, a forthright effort to educate everybody, regardless of your connection to drug use or knowing about it or being a part of it, I believe that CPS is actually a missing factor at a lot of tables. I don't believe that they have the bandwidth, honestly, to come to the table. But
I'm going to say
like
this,
to imagine
I don't either, you know. I mean, I really don't, but sometimes you just, if it's a little child and they're in danger, you got to find the bandwidth. So.
Well, and it is an opportunity, if they join the discussion, it's an opportunity for families to see that CPS, while there to protect children and potentially remove them, they have many other features of their services that, when brokered well and worked on with a team approach, can absolutely benefit the entire family. And I have seen it from start to finish many times as a nurse. And I rest on that, even though it's not as commonplace as children being removed, such that the public is,
yeah. No, I don't think they don't remove much. So, but I see what you're saying, though. I totally agree with you.
But I think it's a good angle, and I'm glad you said it. And I don't know how that could be finessed, because they're very strapped for time, and I have not seen them at meetings lately.
Well, I think between John and I, we do have some relationships that we might go back and at least pose the question of how could we usefully bring you to a table that we think is eager to create a good relationship with you or to enhance a relationship we've already got. Chief McKern?
How about one of the things we probably need to do, and Trish, from the school perspective, have you guys thought about putting out, now that the kids are coming back, we're starting to get them back in the class, we're starting to get them back in there. Have we decided to send a survey home to say, times are tough right now? I think what you're going to find is that folks had some quality closure time. They were in a home. They weren't going anywhere. They were locked down, if you will. And now's the time to come out to say, what are your true needs? How are things doing? How are you doing mentally? Do we need to offer them EAP counseling? And just how are things going? We may not get the answers back on a survey, but at least if we can send it home with the kids, we've accomplished something to say, are your needs, and the key word is, are your needs getting met? We've got food to them like we wanted to. We got education like we wanted to. But are there other needs out there that these folks may need, so that we've at least opened the doors? There's got to be other school districts that have done this. They've sent a survey out, and really it's a welcome back, time to get back to basics again. What are your needs? We know computer needs, we've taken care of that. We know education needs, we've taken care of that. But what are, it's like when we do a little EAP or a little counseling session after a bad call, we sit around there and we go, hey, how are you doing today? How are things going? And so that's kind of the biggie. If we could do something like that, and maybe I'm off base. So.
No, I think that's, what in my little world, we have such close relationships with our families. That happens in so many different ways. If I send a cold survey home, I won't get as much back as I will with, I've talked to 4 parents today and, about different things. And, but I think you're exactly right. We need to know how they need help, and we need to help them. I mean.
Okay, well, this sounds like it's a substantial, hearty conversation, and we want to have it. I want to ask John if he'll stop sharing his screen. I'm going to share mine really quickly, because there's a slide I made up that I wanted you to see that is not in the packet, but there it is. At our next meeting, I wanted to sort of prep the ground for an upcoming syringe exchange. Maybe it happens at the next one, or maybe we don't have time and it's the next one out. But I wanted you folks to be thinking about, as I've gone and interviewed a few different agencies, a few different counties who have rural land trying to work their harm reduction on. They outlined a few different models. Of course, this is a clinic-based, as we've got in Port Townsend, there's the fixed mobile, the roaming, mobile delivery. I just wanted to lay this information in your minds before we have that conversation, so you can start to think about what might work or what combination might be useful in our community. And then also just to log the thought of, is there anything we can be doing at the syringe exchange we have in Jefferson to help establish what the network of need is in South County, or start establishing contacts that we would use to then push some equipment out to, and then they could take it to further out within their network. So those are things that I'm just seeding it with. I realize this slide is not in the packet you're looking at, but it is on the one that's up at the web. And if you will all bear with one more email from me today, I'll attach this updated slide packet to your Evite for this meeting so that you've got it handy. So I think, oh, okay, next meeting is Monday, February 15th at 11 a.m. or Tuesday, February 16th at 1 p.m. an option, folks.
Say those again, please.
Monday, February 15 at 11 a.m. Works for David. And then February 16th is another option at 1 p.m., which is basically the same time as we had today's. Does that work for everybody? Okay, I'm going to send out an invite for Tuesday, the 16th at 1 p.m. Okay, now we'll see what else we had in the packet. I think that's everything. How do we do on time? 2:02. Okay, you guys, thank you so much for your time. Is there anything else somebody wanted to say before we let it go?
Thanks for letting us talk about the vaccine stuff. Sorry about that, Lori. I just felt it was important.
No, I think that was,
When I saw Greg pop on and I saw the other folks pop on, I said, okay, timing's right. We better do this. And we have to take advantage of our medical program director. He's working super hard in the COVID ICU. So when I see his smiley face, I have to use him occasionally and not use and abuse him. So
I think
my input on what the last slide you put up, the only input I'll give you is I'm going to use the word safety. And I'm telling you, and Greg, you're probably smiling because you know what I'm going to talk about. And is that we're concerned over the next couple of weeks with the safety of our responders, of our safety of what's happening. And I think probably we're going to need to start small with the Cool Scene Clinic and do something that's a little more controlled before we just send people out. If you send people out amongst the troops into Upper Quill Scene, or they go up the Quill River or something like that, are you sending someone with them, i.e. law enforcement, security, somebody with a gun? Because they're going to get a gun pulled out. There's no doubt in my mind. We see it every day here in our, this is a country thing. So to bring a little structure, we're going to have to start small, i.e. the Cool Scene. I hate to use the clinic, and sorry about that, Trish, but we're going to have to start using the clinic and something local with a structure behind it. So, Greg, you're smiling because I know you know exactly what I'm talking about. And Doc, you're in the Harborview, you're in the trucks of it, so you see it every day. So there's my 2 cents worth.
Can't hear you, Lori.
Lori, you're muted.
You don't look muted, but
try again. Better? Okay. See, that's technology saying it's time for me to be quiet and let you all go. That is a conversation that I look forward to us having. Your insights are very perceptive and well received. So let's talk about that more at the next meeting. Thank you all for your time. We'll see you next time.